Hi everybody, it's Tim Shea with the Shea Group Realty of Keller Williams in Beverly, Massachusetts. I'm here with another Hump Day Helper and helping you stay connected and getting to know your neighborhood. I'm in the chair of the dentist today over at LeClair Dental in Beverly. And I've got Dr. Donald LeClair with me and Dr. Adrienne LeClair with me as well. Thank you both for having me in the chair today.
You're welcome.
Thanks for coming in, Tim.
So, Dr. LeClair, it's you've been in business for quite some time. You want to talk a little bit about the business itself?
I graduated from Tufts in 1979, June, and opened my practice in downtown Beverly in a different location where we are today in July of 1979.
Okay.
So I've been in private practice since 1979.
Oh my gosh. Okay. All right. You know, one of the most stressful things. There are two stressful things. We'll talk about the second one, but is healthcare and the whole health insurance racket. I know that you've been on the board of directors for Delta Dental for 30 some odd years now, and are also the go-to guy here for insurance. Can you talk a little bit about the ever-changing landscape of health insurance?
Sure. It's been a wonderful experience for me to be with Delta Dental and its subsidiary DentaQuest. They are now close to the largest dental insurer in the United States. It is an evolving landscape right now. It has been the biggest single employee benefit that employers have offered to their employee base since the 80s. And what it has allowed folks to do is they get their annual maximum, whether it's $1,000, $1,500, or $2,500, and it's allowed them to seek specialty care or higher quality of oral health, things like crowns, things like implants, things like bridges, periodontal treatment that might have been too expensive. It allows people an entry, having a dental insurance payment provided for them. I said that the business is evolving because, as is the case in healthcare, the dental dollars have to be spread over more people.
Okay.
And the way the insurers are getting to do that is they are lowering the fees to all providers. So here in the state of Massachusetts, Delta Dental is currently negotiating and contracting with dentists for an entirely new dental insurance plan that will roughly be 20 to 30% below what we typically had received for Delta services prior to that. So it's a major shift, and we're starting to feel the pressure that our medical colleagues have felt for 15, 20 years.
Sure.
So it's a changing dynamic. It's still a wonderful benefit for employees and for the kids of employees in businesses. And having been in the field as long, I can tell when a claim has been paid correctly, and I can tell when the claim has been incorrectly paid. And I act as if you will, an ombudsman for our patient base, where that's not right. Let's seek redress on that claim. So, along with the Delta Dental experience has come an opportunity to offer our patient base counseling and advice on their dental insurance plans and the options that they have.
Okay, wonderful, wonderful. Do you see an uptick in patients coming in because of that, and people having more flexibility to get issues resolved?
Years ago, it used to be, Tim, that you'd come to me because I coached your kid in soccer,
right,
or we were neighbors or went to the same church. Now no one does that. It's all about social media interactions. And now, if you have Aetna PPO, you are going to find an Aetna PPO dentist because it's in your financial best interest to do so.
Right.
So we're finding that people are shopping for dental providers now based on the insurances that they have.
Right.
Everybody wants to maximize their benefit and minimize out of pocket for any kind of dental service, and I'm seeing now, both Adrienne and I are seeing a change in how people get to us and why people get to us. But it's people marching with their dollars. They go where they get their best benefit.
Sure, sure. And speaking of that benefit, so now you've opened it up to a family business here, and so you've brought your daughter into the business, Dr. Adrienne LeClair. How's that working out?
All sorts of fun with that one, let me tell you.
How has that been?
It's been phenomenal. She wanted to be a dentist when she was like 4 years old.
Oh, really?
She'd come to my old office and walk up and down, run up and down the hallways, and I think in her mind she was saying, I'm going to be here someday.
Yep.
And I poo-pooed it. I said, yeah, sure, okay, go pick up another toy. And lo and behold, when she finished high school, got into college, it was a pre-med curriculum, and next thing you know, she's saying, I want to go to dental school. I want to do what you do.
Follow in your footsteps.
So it's been a blessing. As with any family business, there are tough times. You've got to work through those tough times, but it's been a hoot practicing with my daughter and having the patience that I've developed over the many years I've been in practice. Now meeting her and saying how wonderful it is to have your daughter here, and she didn't hurt me, and she's much more attractive than you are.
We'll give you that, definitely. Sure.
So it's been wonderful.
That's been great. You know, starting off, I said that there's two issues, and the second issue that I always have with the dentist, and I know I'm not alone in this, is that just my natural fear of the dentist. You know, you have to experience that when you have patients coming in, but how do you guys deal with that in patients?
Believe it or not, about 40% of people have some degree of dental anxiety. So we know that when they're walking into the chair. And one of the first questions I ask patients is, what part of the dental experience makes you anxious? You know, for some it's the sound of the drill, for some it's the Novocaine. There's a lot of different tricks that we can utilize to make the experience more pleasant for our patients.
Yeah.
And believe it or not, we've even got cable TV overhead.
Oh, wow.
So we can put the headphones on and kick back and watch your favorite TV show. So I think there's nothing more rewarding for us than when a patient hates the dentist and comes in and then starts loving coming to see us. And we have dozens of those patients. So
yeah,
that's one of the best parts for us.
That's great. And looking right up there, that actually segues perfectly into my next question about, you know, there's always in every business in this day and age, there's an evolving technological acumen that's needed. So in dentistry, I'm sure that's happening all the time. What's happening in dentistry, and what are you guys doing to keep up with the technology and the evolution of that?
We're definitely one of the most technologically savvy dental offices around, for sure. We've been doing digital charting, paperless charting for many, many years. So the tooth chart is right above you. Patients love just kind of understanding their entire treatment plan. We have digital x-rays, digital panoramic x-ray. We have an intraoral camera, which is probably our best tool, where we sit there right where you are and I put the camera and show you above your head what could be wrong with your tooth or what's going great with your tooth. And patients see it and they know we're not lying to them. There it is. So
do you still have to do x-rays too, but you're just showing them the...
We do x-rays, we do intraoral photography, we have a full comprehensive evaluation so patients know that we're telling them the truth and we're recommending the best treatment plan for them. So it's, you know, we've also got a new whitening product that we're marketing right now. We're always doing things that are cosmetic and in the patient's best interest.
Is the whitening program something that they can take home with them, or is it something that you do here in the office, or?
I don't know if I can show it to you, but it's the opalescence tray product here.
Oh, okay.
We're doing for $150 this set of trays, and really makes a significant difference. And actually, it's very affordable compared to a lot of the whitening systems that are out there. So,
okay. So they
so
can take it home.
we're doing right now. Yep.
Oh, perfect. So now we're seeing you two here, but you've got a pretty expansive office here, and I've met some of the wonderful staff. But you know, talk to me about your staff. I mean, they're just wonderful, just coming in the times that I have. And
part of what makes LeClair Dental work as well as it has is we have established sort of a theme that we want the business to be run with. It's our mission to provide the best quality care at the right time and the right cost. That's our primary mission, and all the staff folks that we have here in the office that have worked with us, some of them for a long period of time, enable us to do that. And we've got great staff. They're as dedicated to providing this level of care as we are, and for that we're thankful. We enjoy working with them, and it's patients know it, and they feel the chemistry between us, and there might be a little humor involved in the discussion while we're doing these complex procedures, but it all works, and having great people supporting our efforts it's wonderful.
Yeah, and you can definitely feel it the minute that you walk in here. So, you know, you guys are very, very busy, so I just really wanted to thank you very, very much for letting me come in and intrude here and doing a little episode for you. So, you want to tell us how people can get a hold of you, or your location, your social media?
Sure. We're located on 109 Colon Street, right across from the Beverly Senior Center. You can find us on www.leclairdental.com. We've got a pretty active Facebook page and a pretty active Yelp following as well. So, again.
Now we'll start that root canal in a few minutes.
Absolutely. We'll use the intracranial camera. Did you say intracranial camera?
Intraoral.
Intracranial will go in there. So I wanted to thank everybody and thank you folks very much. Hopefully you enjoyed this episode, and you're definitely going to want to check out the Yelp reviews to see what's going on here. If you need a dentist, you have to check out LeClair Dental. And you guys know that if you have any questions about anything, you can always find me at MrLista.com, said in your best Boston accent, MrLista.com, or you can call or text me at 781-789-5128. All right, I think I'm ready. Let's go.
Super.